About 8 million of them have had heart attacks. Around 500,000 people will die of coronary artery disease this year. More than 1 million will have a heart attack. 1/3 of all deaths in Americans older than 35 are due to coronary artery disease. After age 40, about 50% of men and 1/3 of women can expect to eventually develop coronary artery disease. A look at this number of coronary artery disease is enough to give anyone chest pain. The main cause of this disease is atherosclerosis. So what is atherosclerosis? Let's have a look.
Often people get confused between arteriosclerosis and atherosclerosis. So let's start with defining each. Arteriosclerosis is a general term describing any hardening of medium or large arteries, whereas atherosclerosis is a hardening of an artery specifically due to an atheromatous plaque. Therefore, atherosclerosis is a specific form of arteriosclerosis in which an artery wall thickens as a result of invasion and accumulation of white blood cells forming plaques. Atherosclerosis is therefore a syndrome affecting arterial blood vessels due to a chronic inflammatory response of WBCs in the walls of arteries. The accumulations contain both living, active WBCs and remnants of dead cells including cholesterol, triglycerides, calcium and other crystallized materials. Two things that can happen when a plaque occurs are a piece of the plaque may break off, a blood clot may form on the plaque surface. If either of these occurs and blocks the artery, a heart attack or stroke may result.
Oh my word, this is getting really serious. But why do we have to suffer from this? Dr. Rania, can you please explain to us the cause of atherosclerosis?
Well, the exact cause of atherosclerosis is still unknown. However, there are many factors that can increase the risk of developing the disease. The main risk factors are the ones that increase your risk directly. The other factors are the ones that increase your risk of developing the main risk factor. Hyperlipidaemia, which is an increased level of triglycerides and cholesterol in the blood. Unneeded cholesterol will accumulate at the walls of the arteries and then forming plaques, reducing and blocking the blood flow. Smoking damages your blood arteries very dangerously. Platelets will then accumulate at the site of injury, trying to repair the damage but then ends up by forming plaques. Hypertension. Excessive pumping of blood also damages your arteries wall. You can develop hypertension if you are obese, heavy drinker, smoker, if you are stressing. Diabetes. Excessive glucose in the blood also damages your arteries wall. The other factors. Aging. As you grow older, your arteries tend to harden more and more. Air pollution. Recent research suggests that air pollution also speeds the progression of atherosclerosis. Family history. Now Dr. Hannah will explain the pathogenesis of atherosclerosis.
And we have a video for you.
Atherosclerosis is a life-threatening disease. Though the main factor causing this disease is not clear, scientists believe that it is caused primarily by damage to the inner wall of the artery called the endothelium. Over time, substances traveling in the blood such as cholesterol, fats, and cellular waste products accumulate inside the damaged area of the arterial wall. Chemical reactions occurring within the buildup of the wall cause cholesterol molecule to oxidize. This initiates an inflammatory response in which the endothelial cells at the damaged site release chemicals that signal a call for help. In response, monocytes in the bloodstream travel to the damaged site. Stimulation from oxidized cholesterol converts the monocyte into macrophages. The macrophages eat and digest the cholesterol molecules. As a result of this process, the macrophages change into foam cells which accumulate to form plaque. As the plaque size increases, the arterial wall thickens and hardens. At the same time, smooth muscle cells within the arterial wall begin to multiply, remove the surface of the plaque. The cells contribute into the formation of a firm, fibrous cap. Over the time, the cap may break open, releasing plaque into the bloodstream, which slow down blood flow. This leads to the formation of blood clots. As a result, limited blood supply is available to the surrounding area, which is partially blocked. This leads to the degrading and potentially killing of the neighboring tissue cell, causing significant damage to organs. If the organ is the heart, then it can lead to a heart attack.
Now let's get back to Dr. Chris, who will shed some light on the complications that might arise from this disease.
Complications of atherosclerosis depend on which arteries are blocked. For example, coronary artery When atherosclerosis narrows the arteries close to the heart, you may develop coronary artery disease. This can cause chest pain, heart attack, or heart failure. Carotid artery disease. When atherosclerosis narrows the arteries close to your brain, you may develop carotid artery disease, which can lead to stroke. Peripheral artery disease. When atherosclerosis narrows the artery in your legs and arm, you may develop circulation problem in your legs and arm. This can make you less sensitive to cold and heat and increase the risk of burn or frostbite, and can even cause gangrene. Furthermore, diseases caused by atherosclerosis can affect beyond the heart. An entire body is dependent on arteries for oxygenated blood. To mention few, we have kidneys. If an atherosclerosis slows down the flow in the kidney arteries, chronic artery disease can result. This can eventually lead to end-stage renal disease or total kidney failure. Blockage to both kidney arteries can also cause blood pressure to go sky high in a condition called renal artery stenosis. The next one is eyes. Many arteries carry blood to the nerves of the eyes. If an atherosclerotic plate breaks off and blocks the central retinal artery, an eye stroke results, thus causing blindness in one eye. The third one is male sex organ. Arteries in the penis can also get damaged by atherosclerosis and cannot deliver the necessary blood flow. Men need necessary blood flow into their penis to get and maintain firm erection. Without this, erectile dysfunction can result.
But there is one major complication of atherosclerosis, which is myocardial infarction, or we can just say heart attack. But wait, how many of us do really know what is a heart attack? Dr. Rania.
Now let's see what would people say about heart attack. Hi, we are in the dining hall of NT, and now we'll interview some people to find out what heart attack means for them. Hello. Hi. Can I ask some questions here?
Yeah, sure.
A small conversation.
Okay.
Small interview. So, what's your name?
Norina.
You?
Aisha.
What course are you doing?
Law.
You?
I'm doing bachelor's in business administration.
Oh, okay. So, what do you think heart attack is?
Probably it's the death of one of particular muscles of the heart or parts of the heart that dies.
Okay, so what would the business people say about heart attack?
Well, if I say I would like chest pain, maybe, of course. But then what I remember from my medical class, it was like when your arteries get blocked due to high level of cholesterol.
That's good. Both of you have a lot of nice information about heart attack. So this is the public opinion about myocardial infarction. Thank you for your time. Have a nice day.
You're welcome. Bye.
Now let's move on to the causes of myocardial infarction.
The main and most common cause of myocardial infarction is atherosclerosis, which we have explained earlier. But there are other non-atherosclerotic causes. As we mentioned before, there are two different types of myocardial infarction: type 1 myocardial infarction and type 2 myocardial infarction. Type 1 myocardial infarction, defined as spontaneous myocardial infarction related to ischemia due to primary coronary event. Type 2 myocardial infarction is secondary to ischemia due to either increased oxygen demand or decreased supply. For non-atherosclerotic causes of type 1 myocardial infarction, coronary dissection, which is tearing of coronary artery associated with hematoma within layers of coronary vessels. The mechanism of this rare cause is poorly understood. Many of such cases occur in pregnancy, suggesting that hormonal factors associated with pregnancy may be involved. Second, procoagulant states. Hypercoagulable states such as antiphospholipid syndrome, protein C, or factor V Leiden deficiency, when combined with smoking, increase the risk of progressing myocardial infarction. For non-atherosclerotic cause of type 2 myocardial infarction, cocaine, which is a powerful coronary vasoconstrictor that raises blood pressure and heart rate, proceeding through ischemia to infarction.
Now I'm going to explain about the pathogenesis of myocardial infarction, and here's a video to enlighten you about it. Because the heart must continually beat, the coronary arteries serve a critical role, supplying a constantly active heart muscle with oxygenated blood. As we zoom in to observe the interior of this diseased coronary artery, notice the partially restricted blood flow due to the plaque in the arterial blood wall. If part of this plaque ruptures, the thrombus forms and may grow and occlude the vessel. The thrombus detaches, causing an embolism, obstructing the blood flow through the artery. Since the supply of blood has been obstructed from reaching the region of the heart supplied by this artery, the myocardial cells have become ischemic, resulting in damage to the heart muscle. Myocardial infarction can also occur due to artery spasm, which is triggered by stress or intake of drugs such as cocaine. How about learning more complications from Dr. Chris?
Complications of myocardial infarction include ischemic, mechanical, arrhythmic, embolic, and inflammatory disturbances. Nevertheless, circulatory failure from a severe left ventricular dysfunction or one of the mechanical complications account for most fatalities. Ischemic complications include infarct extension, recurrent infarction, and post-infarction angina. Mechanical complications include ventricular septal defect, papillary muscle rupture, cardiac free wall rupture, ventricular aneurysm, left ventricular failure with cardiogenic shock, and right ventricular failure. Arrhythmic complications include atrial and ventricular arrhythmia and sinus.
Coming to the last part of our episode, it's now time to explain about the signs and symptoms, diagnosis, preventions, and treatments of both myocardial infarction and atherosclerosis. For the signs and symptoms, it really depends on which artery is blocked. For example, atherosclerosis in the heart muscles can cause fatigue, shortness of breath, angina, arrhythmias, and sleep problems. Atherosclerosis of the arteries leading to your brain can cause numbness and weakness in your legs and arms, confusion, dizziness, loss of consciousness, loss of balance, and sudden unexpected falls, trouble seeing in one or both eyes, dizziness, sudden or severe headaches. Atherosclerosis in the arteries leading to your kidneys can cause high blood pressure, kidney failures, loss of appetite, nausea, swelling in your hands and feet, itchiness or numbness, changes in your urine cycle. Atherosclerosis in the arteries leading to your genitals can cause difficulties in having sex, erectile dysfunction in men, and in women high blood pressure reduces the blood flow to the vagina. During a physical exam, signs of narrowed, enlarged, or hardened arteries may be found, including weak or absent pulse, whooshing sounds heard using a stethoscope, pulsating bulge, aneurysm in your abdomen or behind the knees. Depending on the results of the physical exam, the following diagnostic tests may be suggested.
Blood tests. Doppler ultrasound. Ankle brachial index. Electrocardiogram ECG. Stress test. Cardiac catheterization and angiogram. CT and MRI scans.
Taking action to control your risk factors and making lifestyle changes can help you prevent or delay atherosclerosis and its related diseases.
Being physically active. Managing stress. Stop smoking. Maintaining weight.
Treatments. Sometimes specific medications to treat symptoms of atherosclerosis, such as leg pain during exercise, are prescribed, and medications for reducing risk factors such as diabetes are also prescribed. Sometimes more aggressive treatment is needed. Physiotherapists can also advise the following techniques. Relaxation. The patient can learn how to relax finger bending and stretching, wrist bending and stretching, triad standing, which is holding a bed rail or a chair where the knees and hips are bending and stretching, standing with your arms raising forward and upward, walk standing, one hip and knee bending forward and stretching. Basically, physiotherapists help you to increase exercise tolerance, improve confidence, provide support and encouragement, help reduce risk factors, and thereby reduce relapse.
Well, audience, hope this episode was very informative. Stay tuned and